Just a little bit this way, please. Hey guys, this is Dr. David, physical therapist with El Paso Manual Physical Therapy, and we're in the month of May. In fact, it's May the 4th, and I'm a big Star Wars fan, so May the 4th be with you, for those of you that get that. But May is also Osteoporosis Month. It's National Osteoporosis Month. And I've got my great buddy here, Julio, who's the owner of XR Imaging, to talk about osteoporosis. So what do you think about Osteoporosis Month?
So it is obviously like any other awareness month, or it is great to remind us that we need to check ourselves, right? And Osteoporosis Month, usually a lot of people forget about osteoporosis, but it is nice that we have a month dedicated for osteoporosis so that we can remember that also our bones are alive and they need to, we need to take care of them.
So what have you got right here? What is it?
So I got two modules. It's a module of the lumbar spine and a module of the femur, which is the bone that we usually refer as to the hip bone, right? And osteoporosis targets these two areas mainly. So it will be your lower back and the hips. As we are carrying our weight and the bones become soft, or we lose density on the bones, those bones have a lot of stress, and then you know, the tendencies for developing fractures in these two areas. Now, if you people who have osteoporosis, they can get any bone fracture. It's just that we want to target these two areas because if there's fractures in these areas, there are major complications.
Mm-hmm. So what age does this start to affect people? Like, when should they get checked out? So
osteoporosis can affect anyone at any given age, but because of obviously the aging process of the bones, we notice that, and the recommendations by the National Osteoporosis Foundation is all females over the age of 50 should get at least tested once every 2 years, and males over the age of 55. We have a major rate of incidence of osteoporosis in females because of hormonal changes, of course.
Gotcha. Mm-hmm. Yeah. So menopause.
Menopause, definitely.
Age, right?
Menopause is one of the major reasons why osteoporosis affects mainly females. But with other conditions and hereditary conditions, obviously, we also see in very few, but also young people developing osteoporosis, and I'm talking as young as 25, even 30 years of age. And one of the major problems with this is that osteoporosis, it's an asymptomatic condition, and for those of you that don't know what asymptomatic is, it means that it presents no symptoms. So you don't know, it's not gonna give you a pain. So if you have osteoporosis but you don't have pain, then you never get checked, right?
Yeah.
Now, if something is hurting, then you go to the doctor, and that's one of the worst things that osteoporosis for osteoporosis, obviously, right? Because you know it's not gonna tell you when you have it. So they're getting a scan, getting a measure, and then most importantly, think about the fact that the bones are also a living tissue. We need to take care of them, like anything else.
Yeah. So if you're 50, if you're a female, it's a great idea this time to go get checked out, go get a scan, and that's something that Julio can help you out with. And for men, 55 and up, very important as well. And as a physical therapist, you know, we're seeing people in here with back pain, neck pain, hip pain, those kinds of things. And if they've had an x-ray, they'll usually, if they're older, 50 and up, they'll usually find at that point, once they've had the x-ray, some sort of osteopenia or osteoporosis. And osteopenia is just the beginning stages of osteoporosis, am I right?
Yes, and you touched a very important point. The radiograph, an x-ray, right, will show you the shape and the way that your bones look. But osteoporosis targets the inside of the bone, right, which will be the bone marrow. On a radiograph, you're just getting a picture of the entire image, right? You're not measuring what is inside. So as I'm looking at a radiograph, or your doctor or a radiologist
you mean an x-ray, right?
An x-ray, yeah. They might say, okay, your bones look weak or they look fragile, but that's just an indication. In order for you to really find out whether you have osteoporosis or osteopenia, you need to get a DEXA scan. That's the only technology that is out there so that we can measure for osteoporosis, or at least rule out osteoporosis. So an x-ray by itself, it is just an indication. It will not diagnose the condition.
So I have had a DEXA scan with Julio before, and it is so fast and easy and simple. And besides telling you about whether or not you have osteoporosis or osteopenia, it tells you your body fat percentage, which is hugely important if you're looking to stay healthy and fit and want a precise number. And I know there's other machines out there that, like, there's the one that you can grip or one you can stand on barefoot. That's called bioelectrical impedance. That can also measure your body fat percentage, but it's nowhere near as accurate as what a DEXA scan does, which is also telling you if you have osteoporosis at the same time. So Julio this month is running a special in case you're interested. I mean, of course, if you're that age, I urge you, please go get checked out for your health. But XR imaging can help you out as well. What's the special?
So if you have insurance, first of all, your insurance covers for this exam. It's a preventive exam, so it covers at 100%. We just need to find out if you haven't had one done within 2 years. Now, if you haven't had one DEXA scan or a bone density scan within 2 years, then your insurance will cover. For those individuals that do not have insurance, obviously, and they're going to be self-pay. Now we are offering the body composition for $40 for patients, or your patients.
Oh wow!
Yeah.
Thanks.
So making it special for your patients, right? And we have a different rate, but just because this guy is very nice, if you're a patient of his, contact us, and then we'll give you a special rate for those of you who don't have insurance.
For this month of osteoporosis.
Correct. It's great. Usually our rate it's $59, right? But on top of that, just because it's the May Osteoporosis Awareness Month, we'll throw that extra discount for all of you.
Awesome,
Yeah.
that's really generous of you, thank you.
Thanks.
One more question, so if you have osteoporosis, let's say you get scanned, or maybe you got scanned somewhere else, and you have osteoporosis, what do you do about it?
So then the recommendation is, first of all, looking at the report and finding out how weak your bones are, right? So then we go by, and not to get too technical here, but we go by a score that is referred as to the T-score. So if this T-score is below 2.5, you're gonna need medication to help rebuild your bones. Plus calcium supplements with vitamin D and also magnesium. A lot of people forget about magnesium. Now, if your score is better or above negative 2.5, then at that point you're gonna enter the classification of osteopenia. So then there you can prevent osteoporosis by taking good calcium, vitamin D, and magnesium supplements. And resistance training is one of the most important things that a person can do to prevent osteoporosis. Be active and do resistance training as well.
Awesome. And so if you need help with any of that, of course you can start by talking to somebody like Julio. I can definitely make recommendations about the resistance training if you're wanting to get started on that. We can connect you to some people that can help you out as well, as far as like trainers and gyms here in town. But guys, it's Osteoporosis Month this May, so we urge you, if you're 50, if you're female, 50 and higher, or male 55 and higher, it is highly recommended you go get checked out to prevent any serious problems from happening further on down the line.
Definitely, guys. And if you know anyone that you can think of, just talk to your friends, your relatives, your siblings, right? Just ask them, hey, when was the last time you checked your bones? A lot of people forget about checking their bones. It's unbelievable, and the worst thing about this, remember what I told you? It doesn't cause any pain. So then a lot of people, they in later age, I'm talking about people who never take care of their bones. They fall, they break a bone, and it's already too late to help them, because, as you know, right,
yes,
on a healthy individual, healthy person, it's gonna take about 4 to 6 weeks for a bone to heal if there's a fracture. But if you have osteoporosis and you break a bone, forget about it, and you don't want to be in that situation. Quality of life, right? Quality of life, that's what we're looking for. So don't forget about checking your bones, it's very important.
Yeah. Well, thank you so much.
No, thanks
really
for having
appreciate
me.
it, Julio.
Right.
We'll catch you guys again soon.
Thank you,
Bye-bye.
guys.